Hi, everyone. Adnan here, and welcome back to another all-star exciting episode of Digital Health on Air. I'm super excited to have Octavia Rolland, who is the Executive Director of Ambulatory Operations at Cook County Health, to join us. Octavia will share all about Cook County and her role, but for those who don't know, Cook County is the second largest county in the United States, and Cook County Health is an incredibly impactful, innovative, crucial healthcare provider in the entire greater Chicagoland area. So super excited to have her here with us. And she's going to share a lot about her unique perspective and point of view in terms of really providing impactful, equitable access to care, and incredibly timely as we spend time with health system leaders across the country. And access is a top priority for folks, especially in the environment and in the world we're operating today. And Octavia will, of course, have her point of view as a health system executive, but she started on the front lines as a scheduler in a call center. So we'll really share how like that weaves into how we think about really delivering equitable, impactful access, not just from the lens of the organization, but from a healthcare consumer and patient perspective, as well as a staff perspective. So super excited to have you join us today.
Thank you. I'm excited to be here. It's my pleasure. I think you're doing a phenomenal job, you and the entire team, having this podcast and just engaging different walks of life, different backgrounds, different journeys to be able to share what we all trying to achieve in this healthcare world, and that just to improve our care gaps and provide the best experience and address access issues, which is across the nation. So it's not unique to Cook County, but I am very blessed to be here to be able to share experiences and partner with some of your colleagues as well. So thank you for
Awesome.
having me.
Well, let's dive in. Kick us off by telling a little bit about Cook County Health and how does it fit into the broader healthcare landscape in Greater Chicagoland.
Absolutely. Now you touched on one of the key facts here. It's one of the largest health systems in the nation. The population that we serve is well over 500,000 members across Chicago and the South Suburban County area. Our mission is to serve and to provide high quality care, regardless of a patient's ability to pay. That has been Cook County's mission from the start. And even through this evolution of, or our journey of healthcare and the government guiding some of the principles of how we're managing throughout this journey, county has remained true to its mission to this day. And so it is a vital safety net institution within this cornerstone market area here in Chicago. You cannot help but to talk about Cook County Health when you're talking about Chicago and the work that we're doing here.
That is incredibly true. And so, uh, thank you for the introduction to Cook County Health. You have, I think, an amazing and very fascinating, inspiring career journey. So tell us a bit about like
Sure.
where you started with Cook County Health and where you are now and how that's really shaped how you think about your priorities today.
Oh, absolutely. Thank you. So first and foremost, as the Executive Director of Ambulatory, my role consists of just pretty much improving and bringing what the community deserve. It is closing the gaps of what is not happening in the community and how do we integrate that into our system? How do we strategize what the priorities are? And how do we ensure that not only are we meeting the community's expectation, improving their care gaps, but also serving a purpose to our employees? It's important that we shine light on our internal customers, and that kind of guides me towards my journey here. I started off as a scheduler. Originally was in school for accounting, but yet this was a job that I was able to achieve at the time when I was in college. And then I started to take some interest into just really how the engine is built. That was
Mhm.
always my analogy. Like, okay, we do these things in operations, and I'm providing a service. I'm scheduling these patients. They're coming in for their appointments, but truly, what does that mean? And if we don't have the capabilities, what happened? And so I continue my education, in the accounting field, but I also continue to work in healthcare because it was something that not only came naturally, but it was a passion that I don't think I really tapped into or understood at that time. And we're talking about over 20 years ago. And I began to embark on this leadership journey, working my way up through the ranks as a supervisor, ops manager, assistant director, director, now at ED. But realizing in hindsight that because of the love of the love of people, number one, and the passion I had about patients not getting what they need at the time that they needed, drove me to explore more options in this healthcare arena because I knew I
Mm,
wanted to give the best and figure out how can we be the best and what did that take. And so I just continued with the journey, and I was very blessed to be able to fulfill this passion. And I work endless nights just trying to ensure that the community is receiving the best quality care, but yet our internal customers, we're building a platform for them to be able to experience the same journey that I was able to experience. And so building programs and help guiding that team to understand why it's important we do what we do. And everyone has a key role into helping our patients stay well and healthy. But in addition to that, how do we invest in you as a team member? How do we meet your needs from just an educational standpoint or your career standpoint? What it is that you do well, and how can I help you see this big picture? And not often did everyone get an opportunity to experience the journey that I had. And I had some mentors along the way to help me understand the big picture, but yet I had a passion that wouldn't allow me to not focus on it. And because my focus was always about the people, consumer focused model, it just kept me going and pushing me further to be able to say, this is what we have to do. And this is the reason why, because this is what they deserve, whether it's our patients or our employees. So now I'm here as an ED. I still get a chance to walk the front lines and visit the team members. I'll never forget, where the journey started, and I'll never forget who am I doing it for.
I love it. Look, I'm going to come back to where you started with in terms of you wanted to deliver the best care for the
Yes,
people in your community. And I
yes,
think that is a theme that we're hearing across the board. And I think folks are also realizing, hey, the way we did it isn't going to be the way we can
for
be
sure.
successful at that going forward. But I want to really dig into one thing which you shared, which is the people internally. You mentioned the internal customer, and I think often as we get involved in process and technology, folks lose
Mhm.
sight of like the internal customer. And so, talk about people, right? Like our your
Yeah,
health team's employees,
yes.
the folks who are at the frontline staff, like how is their workload changing? How are their jobs changing? And how are you thinking about that as you look to ensure that they have the same type of growth opportunities that you've had over your career?
Oh, for sure. So, you know, um, the reflection never stops, right? At my level, I'm always curious about what has changed since the time I departed that role and what still remains the same. And so it was interesting. I had a conversation with some clerks because, I wanted to highlight their outcomes on their registration accuracy rate. And so what we call it is registration quality assurance. And I think everyone is full aware is that it started at the front. You
Hmm.
can put $1 million piece of equipment in your clinic, and if you don't get it right the first time up front with that payer, that $1 million piece of equipment will mean nothing to the institution. It
Totally.
is ensuring that beside the experience, it's getting that data right the first time. And so then the claim can go out clean and we can, receive the reimbursement however we receive it. Um, but the emphasis is so important on that front end, but yet sometimes um, the education is not as robust and or the team doesn't feel valued. And so because you have some team members that are performing at a high level with their registration eligibility accuracy rate is close to 100%. That is that is remarkable.
Hmm.
Um, it was important that we highlight and celebrate those team members. And during that celebration, listening to those team members tell you about some of their opportunities for improvement, or listening to the team member tell you about their experiences and how they feel at certain points. And what didn't change is that the front end feels like they own everything, meaning
Hmm.
if something didn't go right, majority of their feedback is what was wrong or what didn't go right, or versus just hearing some positive feedback in regards to the work they do. If a patient complains about, their experience at the front desk, of course, the team is going to hear about it. And so I remember feeling all of those experiences, and I quickly, took myself back to when I was a scheduler, how that made me feel, and how processes were put in place without my involvement, no engagement from the front end or the team who's doing the job. And so those experiences still live with me today. And as I was listening, it brought back old memories, but it also reminded me why, I fight for having their voices in some of the projects that I'm leading. I am quick to say, hey, let's put a frontline team member here. And it's more than just an engagement tactic. It is, I know how you feel. I
Hmm.
felt that. And reliving those emotions at that time, we're talking about 2001 and 2, I was frustrated. I felt as though the system didn't really want to fix the problem, because if they did, they would ask the people who were doing the work.
Hmm.
And so I make it a mission for myself to stay connected, stay grounded, and find different ways to be able to improve what I'm still seeing today of what I felt during those times. You would think that, healthcare or any organization would have evolved over some time, but just for whatever reason, we just haven't gotten there yet. And I think that we're on the right track. Um, there's tons of investment that is happening in your frontline team members. You see engagement tactics happening, but it has to be genuine. It has to
Absolutely.
be very pure and genuine, and we have to do it for the right reason. So, the initiatives that we have going on in Cook County to improve our front line, I volunteer if I'm not leading to be a part of any project, regardless if it's ambulatory or not, just because I want to ensure that, the team is being reflective as such, and the experience that I own is very unique, and that most people have not walked the lives that I've walked. But in addition to that, just engaging the frontline team member to be part of the project so that their voices are heard, and we leaders at this level understand, how far we come, but yet we still have more work to go.
Well, I know we've always gone along because you have such a authentic approach to how you lead your people and teams, and the no ego approach,
Yeah,
like is screaming loud and clear through how you've articulated it today for our audience here. Uh, I want to stay on this. I think we talked about designing for success, and
yes,
what I hear you say loud and clear is you have to make sure the right voices in the room to be able to truly design for success. And so
absolutely.
you guys have done a creative and impactful work at Cook County. And so
Yes,
look, going back to the theme of uh, um, excellent care, I think what was the word used? Yeah, like excellent care for your patients and your community.
for sure.
That's hard at Cook County for a lot of
It is.
reasons. One, there's a clear mission. It's the county, so there's certain mandates that come along with it. And of course, you have an incredibly diverse patient population. And
Yes.
so, tell us a bit about like how your staff and your people really help other people, patients, get to the care who may have more barriers than someone looking to get care at a local clinic where they just don't have some of the challenges you have.
Absolutely. The staff here, oh gosh, they are remarkable. Um, I can't express the difference. I've been in county for 4 years. This is my first government institution, and it was an eye opener to be able to see, patients and leaders and team members look like who we serve. And we have a large, diverse group of team members that are bilingual, and they are extremely passionate about the people in the community. It is, I can't describe it. I don't know. It's so difficult to put words to it. It's a movement. It's a calling. And, I am religious, and my faith is so strong, and I don't know. It's different. I'm going to say that it's extremely different, and it's moving. And so it starts with the team to be able to carry out this mission. And it's more than just about the patients who don't have the ability to serve. It is being extremely compassionate about their just their living situations. It is compassionate about their housing security, food security, and knowing that quite a few of our team members have also experienced certain traumas. And
Hmm.
you see them going above and beyond. And um, it's what makes us relatable. And so beyond, Cook County making this a strong, diverse institution from bottom on up, it is putting programs in place that is going to address what the community is missing.
Hmm.
You come here to get treated, but holistically, you have to look at how the patient is living in the community, because what you're doing out at home in the community is what's going to drive you into this institution. You can't just solve the problem for 45 minutes, 30 minutes and neglect what's
Absolutely.
happening 24 hours a day, right? You can't do that. It is merely impossible. And so as Cook County positioned themselves to be, a leader in this industry, just embarking on new journeys, whether that's digital telehealth or improving what we already do well, and that is, addressing social determinants before it became social determinants, right? That was
Hmm.
our mission. That's who we are. Um, Investing more into community-based care, which is what we've done since day one. It's taken on these new initiatives, but yet harping on what we do and how we do it well and how we scale it. So the programs makes us unique. The team that we hire. Now, don't get me wrong, we're no different than any other institution where we're struggling with our staffing levels, right? We're
Hmm.
struggling with competing priorities in terms of certain specialties or certain roles, certain technologies that are just very unique, and
Hmm.
the volume is not there in terms of our ophthalmology techs or our dental techs, or, it's just that we're all pulling from the same pool here in the Chicago area.
Right.
But the reality is you still have team members who come here because they believe in the mission. They believe in they believe in caring for the patients in the community that looks like them, or they
Hmm.
believe in caring for the community as once these team members were part of, right? You hear certain team members talk about being homeless or living in shelters or coming here for care and not being turned away because of their inability to pay, which has been an inspiration to these team members to do what they do today because someone took care of them and made them feel whole versus
Absolutely.
making them feel less than. It's just a very unique structure, and I can't. It's sometimes it's mind blowing considering I come from a very large institution before coming here, and not saying that that institution didn't care, but I've also worked for a for-profit institution, right?
Hmm.
So I have
Yeah.
the understandings of how we're navigating through that entity and what rules we put in place and what our expectation was. And this just gave me a whole new dimension, a whole new meaning, even though my faith have always been aligned, but it allowed me to just even, love more about this organization that I did not know until I walked into this space. And I'm sure our team members feel the same way.
Awesome. I'm going to switch gears here shortly,
Yeah.
but you have such a rich perspective here that I want to ask you one more question. You spend a lot of time with your people. Um,
Yes.
what would they tell you is their number one challenge today that they need help with?
In terms of, I would say it, it's a twofold, right? If we're
Hmm.
talking about their future, it is having a stronger organizational development
Okay.
structure and team that's going to help invest. For our clinical team, there's a pathway that's already built for your clinicians.
Right.
And I think that our clinicians are more marketable to get roles versus our non-clinical team members.
Hmm.
And so and I fall in that same category of your non-clinical team members. And so it is bringing a diverse role into Cook County Health, more of the ambulatory side that will help focus on your non-clinical team members, but yet serve as a pipeline to becoming a leader. And
Hmm.
so that was some conversations that you hear from the front line that are non-clinicians. And county heard them, and county have put some things in place, some measures in place to kind of help those folks, not only building an organizational development, department, um, enhancing our onboarding for our team members and leaders. In addition, creating a supervisor role that serves as a pipeline for your clerks. So those roles would afford them the ability to take their very unique skill set as schedulers or
Hmm.
registrars and to focus on that front end and still continue to learn about the engine, right? The operations, but in small doses. And from that point, giving them an opportunity to apply for a clinic management position, but setting them up for success because we were able to create this pipeline and to take them on this journey to allow them to gain the knowledge that they need um, in small doses, but yet setting them up for success, setting the team up for
Yes.
success. And
Awesome.
so,
Okay. Oh,
yeah.
sorry. Go ahead.
Oh, no, no, go ahead. So I was
Okay.
going to say, yeah, that's from an organizational development standpoint.
Perfect. Switch gears. We're gonna look at the future.
Yeah.
Rest of 2025, 18, 24 months. Um, Octavia's she has her whiteboard. She's thinking about like what she's excited about. Um, if we start with access, right? Like as you look
Yeah.
ahead, are there particular initiatives, technology, whatever it is that you're really, really excited for as you look forward?
I think leveraging from technology, leveraging from AI safely. Um, Technology is going to be the most important aspect, I think, in any healthcare institution in terms of how do we leverage to help build our access gaps? How do we use technology to connect with our patients, which would afford us the ability to utilize our staff differently? I mean, let's talk about it. We cannot relive some of the same old practices and think we're going to get different results. You don't have the team members in place to sit and pick up the phone and call and do all these things, right? And it's not efficient. It's not a good use of their time. Um, Leveraging technology is going to be just one of the four focus for us to just connect in the community about their wellness visits or their annual visits that their pads due on, whether it's a breast mammal screening or
Hmm.
colon screening, whatever the case may be. Um, Connecting with our community about a referral that was placed and allowing technology to be able to do those things for us and connecting that. connecting that patient to our call center without having the patient to pick up the phone and call us, right? So
Mhm.
improving that experience. The technology is going to be critical for us on managing that piece, which, it's going to give us the ability to kind of reconstruct our staffing model to be able to focus on the aspect of the care of in-person patients that are in person or at the docs that need to be seen, and allowing the technology to manage things behind the scenes. And even like last minute appointments, you utilizing our technology to say, hey, this is a cancellation slot. Let's pull from this person. Let's pull from this pool, or let's pull from this wait list. We want that activity to happen, but it should not take a human being to do it.
Awesome. Well, I want to say thank you.
Yes,
Thank you for just being so generous with one, your time, but most importantly, just the richness of the perspective and the point of view you shared. Like we went deep, and I think often it's easy to like hit a bunch of bullets, and make sure we play kind of our buzzword bingo. But this was one of my favorite episodes, is we've gone really deep on things that absolutely matter. And one of the things I take away, is when we're designing for success, we have to think about how people feel, not just
yes,
the healthcare consumer, right? But all the folks and the technology that are involved at any
yes,
given point along that healthcare consumer journey. And look, it's a good reminder for me. We can't just focus on what needs to get better and change and what didn't work, but also to celebrate the wins when 85, 90, 95% of the time things are going well. And we just
absolutely.
as problem solvers focus on the 5 to 10% of things that aren't going well. So thank you. This
Yes,
was an absolute delight. Thank you, thank you, thank you. And we will have to have you back in a quarter or two to hear
anytime.
what the updates are, and how Cook County Health is evolving with technology to deliver impactful, equitable access at scale in a growing community. So thank you, thank you,
Yes,
thank you.
thank you. Thank you for having me. It was my pleasure.
So we'll see you, Octavia. Thank you.